Meryl Ann, and for today's video, we are going to demonstrate on how to correctly or properly input the patient's information using electronic medical record. And so for a quick understanding about what is electronic medical record, so it is an electronic record of health-related information on an individual that can be created, gathered, managed, and consulted by authorized clinicians and staff within one healthcare organization. So as the system shifts from papers to screens, as healthcare providers, we must gain knowledge about the privacy it needs through the Data Privacy Act of 2012. In this way, we would maintain the work ethics and the standards inside the institution. So the rights includes the following: right to be informed, right to access, right to object, right to erasure or blocking, right of damages, right to file a complaint, right to rectify, and right to data portability.
Let's now proceed on the demonstration by using the OpenMRS, which is a platform that is flexible and user-friendly. The first step is to log into the website, and for this purpose, we will be using the inpatient ward. And then, explain to the client the procedure.
Ma'am, I am going to record your personal information on our website to keep track all your files and information. We assure you that these are all confidential. Is that okay?
Yes, thank you.
Then, register the patient and input the personal data.
Can I have your given, middle, and family name, ma'am?
Mariel B. Lucero.
By using this website, it includes the demographics, contact information, and relative of their choice.
How about your address, ma'am?
Block 1, Lot 2, Villanueva, Canay, Cavite 4110.
What's your phone number?
09111-223-445.
And who do you want us to call in case of emergencies?
My mother, Maria Lucero.
Okay, so that's all for the personal information. Thank you.
After checking, confirm the submission to proceed on the next step. And then, start the visit and confirm. Click the Admit the inpatient for this purpose.
So I have scheduled you for inpatient ward, so kindly wait for your turn to be called, and for the meantime, kindly go to the front station to check your vital signs and other necessary assessments. Thank you.
Afterwards, record the vital signs under the Capture Vitals. This includes the height, weight, BMI, temperature, pulse rate, respiratory rate, blood pressure, and oxygen saturation. With the case of Miss Mariel as shown on the screen, the data can be recorded on the visit notes. And here, input the medical diagnosis under the presumed or confirmed diagnosis, which is the asthma. Then, under the clinical note part, put the nursing diagnosis, which is ineffective breathing pattern related to shortness of breath, fatigue, positive use of respiratory muscles as evidenced by bilateral expiratory wheezing and 110 beats per minute of pulse rate. Next is to place the planning process, which is the patient's breathing pattern is maintained as evidenced by normal lung sounds and regular respiratory rate or pattern after 3 days of nursing interventions. For the interventions, we have to monitor the frequency, rhythm, and depth of breathing. Second is to auscultate and percuss chest to evaluate the presence and characteristics of breath sounds and secretions. Third is to review the laboratory data such as the ABGs, drug screens, and pulmonary function studies. Fourth is to encourage deep coughing and breathing. Fifth is to position the client's chest in a semi-fowler position for a better airway. Sixth is to note the emotional responses, because the patients have the tendency to have an anxiety due to hyperventilation. And then last is to reassure the client and give support when the attack happens. Evaluation is also included under the clinical notes. As for the given case, it shows that after 3 days of nursing interventions, the goal was met as the patient's breathing pattern is maintained as evidenced by no presence of abnormal lung sounds and has a regular rate or pattern with 80 beats per minute of pulse rate and relaxed respiratory muscles. After the data input under the visit notes, click Save. Proceed on asking the patient if she has any allergies to determine further interventions needed.
Ma'am, I have another question for you. Do you have any reaction whenever you take food or any medications?
No, miss. I can take the medications or any food well.
After recording the allergies, there are also other options in recording data such as about the family, additional conditions, and also the attachments which can be placed the essential files such as the laboratory results. On the general actions on the side, other functions include additional and scheduling of appointments, may also indicate the patient deceased if ever, and may delete the patient's profile. Before ending the session, make sure to ask for any questions or clarifications to the patient.
So that is all for today's appointment. If you have any questions, you may feel free to do so.
Well, I was wondering, isn't all the information you asked too much for a medical record?
No, ma'am. These are all essential medical records, since this is a way for us to evaluate how we could give the most efficient and effective care, specifically on your condition. Our utmost priority is the airway, such that it is important to record the vital signs, the physical assessments, and even the allergies for medical purposes.
Oh, how about all the personal information?
Regarding your personal data, this is both beneficial for us so that we could verify if the client that we are giving the intervention is correct.
Okay, I get it now. Thank you for accommodating me.
No problem, ma'am. If you still have any questions, you may contact us. Thank you and have a nice day.
Lastly is to remember that in every patient session, we need to log out their profile to prevent hacking or any unlawful acts that can be used against the healthcare providers. In this way, both parties are being protected.
So that's it. I hope you learned how to manage the client using the electronic medical record and the relevance of the online data of the patient. That's it for today. Thank you guys for watching.